Why don't we go ahead and get started? Why don't we go ahead and get started? We're going to be out here about 1, so. Okay. Welcome, everyone. You too, Ed. Welcome, everyone. I'd like for, before we get started, I'd like for Ed to lead us in a word of prayer, and then we'll do introduction to the students.
Pray with me, please. Oh God, our liberation and peace, we seek the power of your Spirit, that we may live in full union with you, ourselves, and our sisters and brothers with mental health illness. May our actions and decisions lead us to overcome fear, acquire knowledge, and be advocates for compassionate and enlightened treatment and service. May we go forward into our community with a renewed sense of vision, hope, and new beginnings for the future. Amen.
Amen. Thank you. Go around the table, everybody introduce themselves and the counties which they represent. I'm Rick French. I'm the county manager of Alexander County and the Smoky Mountain Chair.
I'm Jay Calvin, Board Attorney. I'm Ronnie Neal, Vice Chairman of the Macon County Board of County Commissioners, President-elect of Smoky Mountain County Commissioners Association.
Michael Ladler from McDowell County.
I'm Daniel Johnson, Cherokee County, and I'm on the executive.
Randy Wiggins, Cherokee County Manager.
C.D. McKinnon, Cherokee County Commissioner.
Greg Cable, Graham County Manager.
Vicki Green, Jackson County Commissioner.
Don Adams, Allegheny County Manager.
Larry Cox, Allegheny County Commission Chair.
Mike Hawkins, Tracy County Chair.
I'm Wanda Green, Buckley County Manager.
I'm Steve White, Henderson County Manager.
I'm Andy Stubb, Buckley County Assistant Manager.
Carl Classen, Rutherford County Manager.
Joe Martin, Yancey County Western Highlands Board and Transition Team.
Nathan Bennett, Yancey County Manager.
Artie Wilson, Transylvania County Manager.
Chuck Wooten, Jackson County Manager.
Jim Baker, Madison County Manager. Excuse me, Commissioner.
Alan Lamberson, Madison County Manager.
Keith Elmore, Chairman, Wills County.
John Yates, Wilson County Manager.
Bill Kennedy, Watauga County Commissioner.
Darren Gio, Watauga County Manager.
Nathan Miller, Chairman of Watauga County.
Glenn Johnson, Avery County Commissioner.
Phyllis Forbes, Avery County Commissioner.
Robert Wiseman, Avery County Manager.
Mark Swanger, Avery County Chair.
Ira Dell, Hayward County Social Services Director, here tonight from Alexander County Manager.
Charles Vine, Clinton County Manager and Chairman of the Western County.
Ed Charlton, Wilkes County, former Smoky Mountain Chair and Executive Committee of Transition Team.
Judy Bowman, Ash County Vice Chairman.
Jill Howard, Executive Assistant, Smoky Mountain Center.
And I'm on here, Cancer Consulting with the Smoky Mountain and asked legislator, asked for that secretary.
Again, I'd like to welcome everyone tonight. We're here to discuss a very important matter for all of us. Like everybody has an agenda. I know. So at this time, I'd like to call on the leader to start us off. And then from this, we'll have discussion, comments, and let's talk this thing over. So, from here up.
Well, thank you. Let me just make some comments and maybe let Jay actually review the legislation. I think before you have 3 pieces of legislation that we passed in the last couple of years around governance, management, operations of what we now have as MCAs. And some of you have probably been involved in this a long time, some maybe not as long. We went through a reform where we went from area programs to LMEs, and then we did a pilot down in Harris County and tested out the idea to become a managed care organization, and now we've gone across the state, and we have currently 10 MCOs across the state. The new governor, when Governor Corey come in, he talked about comprehensive care and talked about going to perhaps commercial MCOs to run Medicaid, which would include behavioral health. so a lot of discussion over the last 8 months has been, are we going to do that? But the legislature has not been as interested in that in my conversations with them, but they are very interested in going to more of a at-risk environment for healthcare in total. What you've done and what the MCOs across the state have done, behavioral health has accomplished in the behavioral health arena what they want to do across the board for all of healthcare, but they want to do it in a more comprehensive manner. So as they're going down the road, they're looking at how do we have fewer organizations, more regional approach. And a part of what we've done here in Western North Carolina with these 23 counties is taking 2 organizations and created a new organization that is doing just that. But as the legislature often does, they continue to be concerned about different aspects of this. And whenever the first MCO or first LNE really to take over others down in East Carolina, when they got up to 19 counties, they began having difficulties getting enough board members together to have a forum to conduct business. And that led to some of the discussion that led to some of this legislation about governance, about changing it to a maximum of 21 members, et cetera. I know that's concerns to you. And we'll talk about that tonight. I know there's some discussion going on about trying to get that reversed, and whether or not that happens or not, I don't know at this point in time. The law we have says up to 21. And the law we have, I think, says either be appointed 21 or the secretary has the authority to appoint for us. And I think however we go about this, we would rather have that control here than that control there, even though perhaps things change in the future. They also talked a lot about the whole process if an LNE or MCO wasn't doing well in the process with the change of assets, that was another one of the pieces of legislation. So they paid a lot of attention, and they're really counting on, and quite honestly, you've been kind of the way the MCOs and behavioral health have been able to demonstrate that we can have a system of care that provides access, provides quality, and provides it in a cost-effective manner in an at-risk where you're really focused on providing the right care, achieving the outcomes, as opposed to good students of service. And that's what we want to duplicate across the state with respect to physical health. And doing a comprehensive system, you already have to be real players in it. I think the legislature wants to make sure there aren't failures, wants to make sure the state doesn't end up with a problem with people aren't getting services. And that's where a lot of this legislation is coming from. Now, whether we agree with it or not, that's one thing. Right now, we're having to deal with it the way it is, and we want to change it, that's fine as well. I don't want to change it, because that's where we are, so we can get down that road. And I think, I did talk to the County Commissioners Association today. I think the County Commissioners Association has made one of their legislative priorities to make that change. And so, but that would be sometime next year, probably April, May. Well, it's the session that comes into May, so it has to be May, June, July before that happens. So we have to deal with what we got until that point. Now, I think that's part of what the discussion is going to be tonight. So just with those few opening comments, Jay, you want to give a little more detail about the legislation?
Sure. In your package, you have Senate Bill 191, which is the nugget that we need to talk about tonight, and the purpose for talking with you tonight is to tell you what the law was and what the legislature has changed the law to be now. And before the legislation, you had a structure which allowed for at least 11-member board, up to 25 members. There was an exception that allowed some authorities to go to 30 members. And Smoky Mountain Area Mental Health was a 30-member board. And the way that board was comprised was you had 15 counties, and each county had a commissioner who was a part of that board. And then they appointed another person from their county to be part of that board. So that's how you put that board together. You didn't necessarily have to have the same kinds of membership that you do now. You did have to pay attention to some things. It was kind of a general description where the board needed to make sure that it included individuals with financial expertise, management, business, and an individual representing the interests of children. A number of years ago, some of y'all remember back before 2000, there were actually some more descriptive positions in the law. They loosened it up after 2000. They'd be a little bit more general to give the county commissioners a little bit more leeway in who they appointed to be part of that board. And that's the way we operate for about a dozen years. And so the legislature in the past session has changed that fairly substantially. One of the cornerstones of the old law was every county would be represented in the area of authority, and that's no longer the case. It's impossible under the new law for that to be the case because the numbers that they've given us and the definitions of membership have shortened that quite considerably. Now, again, you have a minimum of 11 members. That's still the law. But now you can have no more than 21 voting members. So the Board of County Commissioners no longer have the leeway to put one of their commissioners on the board and then let the group of county commissioners make a selection about the remaining county commissioners. The process basically requires you to look at 13 different categories and try to fit into that category someone, whether they're a commissioner or not. In most instances, they're not, to fit in that position. And they are listed in your Bill 191 on the second page, beginning about halfway down. You'll see 13 different types of positions that the General Assembly says that you have to have on this board, and only one of which is a county commissioner.
Chair, can I get a rough?
Yes.
And I'm not trying to indicate you don't know this, but again, for those of you that have not been involved in the legislative process, and looking at a bill like this, anything underlined, new language, anything crossed out, obviously eliminates that, and anything that's changed either one way or the other, it's existing statute that continues in the statute. They're kind of give you an idea of who versus what.
Right. Okay, so you can see, as Mr. Chancellor says, that, and for example, B1, physician licensed under Chapter 9 is scratched through, so that's no longer required. But the underlying part is the new part, and that is required. We get one county commissioner. It's not a maximum, it's just at least one county commissioner on the new board. There are three following positions that are Consumer and Family Advisory Committee positions. That's called CFAC. That's our acronym for that. So those three will be CFAC members. In the past, we've had one CFAC member who made a regular presentation at every board meeting we had, and I thought she represented the CFAC very well. The General Assembly obviously wants the CFAC represented 3 times as well in this particular bill. And then you have 5, someone with healthcare expertise, 6, healthcare administration expertise, number 7, financial expertise, and these are all on the scale of the managed care organization, which is what Smoky Mountain is. An individual with insurance expertise, an individual with social services expertise, an attorney with healthcare expertise, a member who represents the general public that is not employed or affiliated by the HHS, appointed by the secretary. Presumably that person will be nominated by the air authority appointed. The president of LME MCO Provider Council or the president's designee shall participate in an advisory position and an administrator from the hospital. So you can see you've got 13 different positions that are prescribed before you even think about the remaining membership to get up to a limit of 21. We've tried our very best. Mr. Lavender, who's sitting at the corner here, has worked very hard and has come up with a list that we think that would be adequate. But because you have to fill those 13 with people who fit those categories, you just can't find many county commissioners who actually fit those categories. When you go down through there and look at who you've got, you don't see many county commissioners in that first 13. So it's even worse than that. So you not only below the number, period. In other words, you're going to miss 2 out of 23 counties anyway. You're going to miss a lot more. So inevitably, there's going to be many counties, as dictated by the General Assembly, who are not going to be represented. Unless the limit on that number of people that can be on the board of directors is expanded, or unless you take some of those prescribed positions and decrease those. That's the only way that you could do that, but unfortunately, the law is, right now, that's been passed by the General Assembly, says this is what you have to do in order to fill this board. I will tell you, for those who have not attended some of our board meetings, that we've been pulling hair and gnashing teeth about this for a long time. Nobody in this organization likes it that I know of, and we all understand that when the General Assembly does something like this, that you have to really have a soul searching about whether you obey the law or whether you try to figure out something else. And that's why you're here, is for us to put before you what the General Assembly has passed in North Carolina law. And just tell you, it's not Smoky Mountain's fault, it's not Western Highlands' fault. It's the legislators who decided to do it this way. And with that, I'll tell you that there are other things that are changed that have some bearing on what we're talking about. The bullseye, what we're talking about is this particular legislation right here.
I will just mention, there is a provision in here that the catchment population is 1,050,000. Then you can, if all the county commissions pass resolutions, you can change or modify that makeup. But it has to have at least 1,250,000 catchment area under this current legislation in order to be able to do that.
And just to follow up on that, in order to get to that population, you would have to merge at least 2 more area authorities into this one before you had the requisite population. So you'd not only have to go from big to bigger, you'd have to be huge. And that's perhaps what the General Assembly is looking towards. If we did that, it would comprise basically 1/4 of the state, basically all the mountains and most of the Piedmont.
Another question?
I do have a question, Jay.
Sure.
How are you?
Good, hey,
Good. On,
you need a haircut.
I know, it's getting long, it's starting to get in my eyes. 122C-118.1, which is on the first page of the actual law, but really on the second page, the back page. All right, prior to Smoky joining with Western Highlands, how many were on board of Smoky?
How many counties?
How many people? 30.
30.
Okay, and how many counties was that?
15.
All right. So now that we joined with Western Highlands, Smoky's joined with Western Highlands, what gives the Smoky Board the authority to appoint the new Smoky Board? The way I read the statute here, it says an area board shall have no fewer than 11 and no more than 21 voting members. The Board of County Commissioners or the boards of county commissioners within the area shall appoint members consistent with the requirements. And I know the old Smoky Board has, Watauga has an extra member, Mr. Charlton's an extra member for Wilkes. I'm not picking on him, he's just the one I remember at this instant. This says the Board of County Commissioners. So what authority are y'all using to form this new board? And the reason I ask this is because, as I understand it, Watauga is not going to have representation. And behind Wilkes, we pay the most. I don't know about the Western Highlands people, I don't know how much they contribute, but of the old Smoky combination, we're right behind Wilkes as the highest payer.
It's a great question. It is absolutely the question, I guess it's on everybody's mind. We don't have the authority. Number one, it has been Western Highlands working with Smoky Mountain. Western, just as of the last board meeting, became part of Smoky Mountain. So, but prior to that, since the division in the department told us we needed to merge the two together, we've been working in executive committees and joint committees to make sure that Western and Smoky were working hand in glove. So it's not just Smoky, it has been Western, and if anybody from Western wants to contradict that, I go right ahead, but we've tried really hard to make sure it was both. But we are basically just saying, here's who we think would work in this situation. We can't really say that you have to appoint all these people.
So who's going to do really a nomination?
It's like a nomination.
A nomination that the county commission vote on. There's nothing that I can read that says it has to be unanimous decision by all the county commissioners. But it's really a nomination, so I would guess if you wanted to nominate someone else to be on the board for the vote, you could do that. But each county commission is going to vote on who they go on the board. I guess they vote on the full ballot, right? The slate, and so you can modify the slate, but whoever gets the majority of the county commission votes is the one that will be on the board.
Two things, Mr. Chairman. First is, the thing to remember is that this is that the recommendation that would come from the board to the county is for basically an interim board. As most of you know, who've had contact with your representatives on the board, there is discussion with other LMEs or MCOs, if you will, for some merger activity, because it's very clear that the state is wanting to move to, Brian reminded me, is it 4 or 5 within the next basically year. And we can either choose who those partners are and work the best deal we can for all of us, or we can go along the dragon, kicking and screaming with somebody else being in control. So the likelihood is that if we go through those mergers, this kind of interim, if you will, board that would be comprised will only last until we get to the 1.25 billion, which could very well be within the next year. The other thing is that in the event that didn't happen, one of the things we've been trying to work on at the executive level that was in the last board meeting is trying to figure out a rotation schedule that would make sure that we had representation over a broader period of time from all the counties. There was no attempt to leave anybody out. Quite honestly, I sat at home night after night trying to work little schemes to try to figure out how you could get the most, for example, pairing large counties and small counties, and pairing, northern and western and central, and it just doesn't work out with 21 members, 13 being prescribed. And we asked long and hard trying to find current county commissioners or current board members that could be, for example, someone with healthcare management experience at the MCO level. If you all know any of those, I'd like to hear that's already a county commissioner, for example. So it's just a not impossible task, but what we were trying to say is we statute so that we can move on and adhere to the letter of the law, then our next step would be to try to work out a rotation schedule in the event that we can't cross that 1.25 million threshold sometime in the next year through mergers. And quite honestly, if we don't merge, other people will be telling us more what to do than this legislation, because that's the way it's moving. It's moving to, if you're not big in the governor's scheme, you're not going to be a player. You're not going to be sitting at the table. You might be under the table or out back with the horses, but you're not going to be a player at the table. You're not one of the big guys. And that's unfortunate. That seems to be the way it is.
Can I give a shot at answering that same question? Sure. This is the history of this legislation. This started way back in the summer. We have met with Nelson Dollars on numerous occasions, who was the sponsor of this legislation, telling him that when it got to this point, it was going to be an absolute nightmare. It is there now. Here's what we've done so far on behalf of the county commissioners. We went to them with several proposals. Number one, about the population. Our population for 23 counties is about 1,062,000. We had two arguments. One, that was in the percentage of the plus or minus of this new census. We thought that was a strong argument. Number two, in most of our counties that are sitting around this table, your population doubles right now where you're at. Some of those folks are using mental health services in your ER right now. That was our two arguments. Plus, it had already been done in Wade County. They had already been given a waiver for population. So there's a precedent already set. We thought it was a good argument. Met with their attorneys at the DHHS, which have now gone, they got new attorneys. I don't want to tell you about that. They said no, that would not work. So we come to this point. So now the argument today, we talked to them today, that you're asking the Board of County Commissioners of all 23 of our counties to vote for 21 folks who's not going to represent you. You don't know what's going on in that county. One county commissioner. You're going to be asked to put money into an entity where you have no control. Now, you do have a 23-member advisory board, which is a kiss your sister board. You have no governance, you have nothing. You can go to the meetings and say, oh yeah, this is what we need, but actually, as a county commissioner, with this legislation, we're out of the picture. So now what? So we asked today, and we'll talk a bit later about some resolutions in the far west that we have started. We have all but Haywood, and I think that Chairman Swinger's going to wait till after the meeting tonight, and I'm sure his board will pass it. All 7 counties will pass the resolution. I have a copy that you can certainly read. We have given a copy, met with them in Raleigh last Friday, a week ago Friday, and let them read the resolution of what we were proposing. And they said, well, that's good, we got to adhere to the law. And I understand that, so I don't think the DHHS is going to have the authority to do that. I think that our best opportunity, here's our choices. These 21 members, let's say it never comes on the agenda. I don't think they'll ever see the agenda in Macon County. I'll just be honest with you. I don't think they'll ever see the agenda. But if it don't, what said to the governor to come in and appoint these people. They're going to adhere to the law. But there's so many areas that are so vague on what's been done to the counties that I think we still have a case. And I think we'll carry these petitions. I'd like for y'all 23 counties to read our petition, word it how you see fit. But never before, on almost anything that affects our counties like this does, have the county commissioners, elected officials, been completely shut out, like they are here. Yes, sir.
I noticed in the statute where it even speaks of the county commissioners having the authority to step aside from the 13 separate positions. If there's a total population of 1,250,000, speaks that there has to be written permission given by January 1st, 2013.
But there's a subsequent legislation that covers that.
Okay.
But if the population, on the population thing, I think that if all of our census and the plus or minus, I think that was a good argument. We've made it the best we could, the best I could, and the best we all could on behalf of the county commissioner. I think that was a strong argument, and the president already said for that. And the secretary does have that capability. She can grant that. What this petition, or the resolution we have now, we're asking just to wait. If we take in, which is probably next, according to what I hear, is Centerpoint. Centerpoint consists of Stokes, Rockingham, Forsyth, and Davie County. That will put us almost to the peak. We're not that far away, from the population threshold. And it's been my opinion, and of course, I'm not very educated, so I tell it like I see it. The two boards are actually reversed. The 21-member board should be the advisory board. That should be your advisory board. And the 23 counties should have whoever that county decides to put on, because that's where the money's going. That's been our contention from the beginning, and that nothing's changed. This piece of legislation, just to give you a little history, was the last piece of legislation. At the last hour, I was there at 2:25 in the morning when it passed. It's the very last thing. We're going home, boys. Put her through. And that's exactly what happened. Mr. Kennedy.
Michael, I want to thank you for all the work you've done. I understand it's a bad situation. So to me, it's just a question of what we do. And if it's true that it says here the board of, and a lawyer can maybe clarify this, board of county commissioners, and the county commissioners don't do this, then and should this board be only county commissioners? So that means that people that are on the board that are not county commissioners are not voting members then? I mean, it's confusing to me. And so the question is, okay, we've done everything we can. What else can we do to stop this lack of representation in this organization? And I understand it's frustrating, but to me, this is our chance. I can't vote to take myself off this board in good conscience. And I think all the other commissioners should be thinking that too. So how do you go back to your people and say, yeah, I just voted myself off this board so that because they screwed up in Raleigh? Well, we're supposed to come up with solutions, not just go along. So I don't have a solution, but I'm not.
And I don't want to answer Jay's question, but I really think they are looking for something they can hang their hat on. We thought we'd give them that with the population, because in Wake County, and Greg Cable can explain exactly how that went down. I asked them to, they didn't want it. Nobody knew that. That was the redhead stepchild. They didn't want nobody to know about that. But it happened, and so it's a precedent had been set. So, I think now it's going to take, I think our representation from over our way, both representatives, that they voted for this legislation. And said, well, we didn't know exactly that's what it said. Well,
now, Watauga County did pass the resolution talking about we took out the last whereas because we're not in that Region A, we're in Region D. But I think all the counties, if we had a unanimous passage of that and every county in there sent a message, that, I don't know.
I think that's our best shot, and I think that with our conversations today with those folks, that, I think we're going to have to go to the next rung up, which is the governor. And Secretary Cantor can certainly tell you how it worked when he was there, and it worked that people would talk to. And it's a little bit of a struggle now. There's constant change in the DHHS, the Medicaid section of it, and the attorney section of it. So the only thing we're asking in the resolution is just for some time. Give us the April of 2014. Give us a little time to let's see, are we going to take in Center Point? That seems to be the top. If we do so, we're there at the 1.2.
And I do understand if we're not in compliance, they're going to appoint the board. I'm aware of that too, but.
So let me give you two examples of how powerful the secretary is in the situation. Number one of the reasons that we merged with Western Highlands, because the secretary terminated the contract that the state had with Western Highlands. And basically said, you're going to have to let somebody else take over your operation. They could do that to this organization again. They could terminate the whole kit and caboodle, and then they could say, let somebody else run this, and then not only would you not have any representation, you might have representatives from way out of state to telling you what to do. So, I mean, it's happened this year that the secretary was able to say, we're going to reorganize what's on the table. We didn't like that, and the people who were at these board meetings saw how hard that was to put together, and managed to do that. The other thing is, I think that if the secretary finds that the counties don't approve what has been put out, the secretary can appoint whomever she wants to put on the boards. So that's why we have attempted to swallow this bitter pill and say, we think we have a good slate. We have two good ideas about how we can get over this in the next year. One is we merge sufficiently to be large enough to get the county representation we need, because there aren't any rules after we get to that point. We can go back and make up our rules for the board governance and composition. The other is that the legislature's going to meet again, and we certainly have someone who's down there in Raleigh trying to talk people into changing it. And my personal feeling is that if you do pass this, in the next year, it's going to change anyway, again. If you don't pass this, the secretary is going to impose whatever the secretary decides to do upon you, and you won't have any say-so in it whatsoever.
Let me just make a comment about what the secretary may or may not do, and I certainly cannot speak for the current secretary, but just to give you an example, while I was secretary, we had a situation where there was, in the budget, the legislature passed a trigger that said if we had to save a certain amount of money by a certain point in time, I was supposed to reduce every provider's reimbursement rate, doctor's physician, everybody by 6%. And as we approached that point in time, the federal government wasn't making changes, didn't make that stuff, et cetera, and I knew we weren't going to hit that. But I had a legislative mandate to do it. So I went to the governor, I went to the leader of the Senate, I went to the leader of the House to talk about it, and they said, we agree this could be devastating, don't do this, we'll pass legislation when you get back to code. So that's what I did. I ignored the law, and they did it. Well, remember the state auditor's report that came out that the governor said Medicaid's broken? Well, one of the big issues in that audit report was the department did not follow the direction of the legislature and did not reduce those rates when we were supposed to. Saying basically I ignored the legislature. The secretary has said that's not going to happen on her watch. So my guess is, unless she wants the state auditor to come in and say, you ignore the legislation, they come to the end of this calendar year, I think it's when they're supposed to have what names are called, right? That if we don't have not elected a slate, then in order to say that she's complied with the legislature, she will name the slate. And so given that, I think it's important. But again, if you feel like the slate that's out there needs to be modified, I don't see any reason you can't modify and vote on a different slate. If a few of the county commissions don't vote on it, then the way the law appears to read is the county commissions elect the slate, but it doesn't have to be unanimous. So if somebody doesn't vote one way or the other or vote on a slate, then I think the board still gets elected. And so the question is how you're going to handle it short term. You know, if we look at creating, the state wants 4 regions, and 4 regions would take us pretty much from Winston-Salem. And if we did that, we obviously have enough. We have 35 counties or so that did that. They're supposed to be contiguous, so you have to pick up everything along the way. We'd have 35 counties that have more population. You can recreate your board, you can do whatever you want to, and I can tell you, having had conversations with some of those other MCOs, they got the same worry you do. They don't want to go off the board, and so I expect that'd be something everybody's looking at doing once you get past the DN250. Of course, when you get 50 people on the board, it makes it kind of unwieldy. You have to figure out how you can make that work. But you could have the overall board representation. It seems to me right now, continue your battle, try to do what you have to do. But I would not suggest putting the secretary in a position to see if she will name folks. Because if she wants to try to avoid being criticized by the state auditor, she's probably the one to do it. She's already got one ticket on the list where they failed to get something sent to the feds when the legislature said to. I think she's going to try to avoid that because right now, as the News and Observer reporter told me the other day, the HHS is the gold mine for news, and every day there's some story coming out of the HHS.
We've talked a good bit about reaching the 1.25 million magic number there in the catchment area. But it also says that with and receiving written approval from the secretary. So there's no assurance that even if we reach that 1.25 million, that the secretary will in fact approve that board that we select.
And you're absolutely right. However, it also says before it goes to the secretary, all of the county commissions have to pass a resolution saying they want to go away from these rules and create their own rules. My guess is politically,
I think what's really sticking in the county commissioner's crowd here is the maintenance of effort monies that's going in, and the state is basically dictating what we're going to do. It seems to me, and I said this in the board meeting in the past, I think the last, if the state wants to take over mental health entirely and do just as they want to do, then that's fine. But if they're going to do that, then they need to be putting the entire bill. We need to be out of this maintenance of effort, of effort money. And there's nobody in the Western world that knows how we came up with the amounts each county there seems to be no one that can tell us how we came up with that amount, but yet the statute says that we cannot reduce that amount. Please do, because nobody's been able to.
I was chairing the appropriations committee in the House where this was a discussion. And what was happening as we were making changes in mental health, and we were doing some expansion, we were getting some additional federal dollars or whatever, different counties had voluntarily put money into the system in order to help fund the mental health. And as they were putting more Medicaid dollars into it and other state dollars into it, they said, well, we don't want to put more money in, and then the counties take their money out, and we end up better off. And so basically, where you were at that point in time is where you got locked in to maintain it. That's what happened. It was, okay, everybody's in. They don't want the county commissioners to reduce their funding because the state's putting more money in, so this created maintenance effort requirement. Same way the Fed does to the state. The Fed has situations in the state and child care subsidies, but does in other places. The state has to maintain a certain spending level or they won't send you the money in. Obviously, they can't not send the money or they won't have mental health services. Because really across the state, the maintenance efforts like 2 or 3% of the total package. But it is money that for small counties particularly is a challenge sometimes. But that's how it got there. It was the amount of money they were spending at the point in time that they made that change. They said, okay, you can't finish it.
So what happens if a county or counties in the next budget cycle does not contribute that money that the statute says we are to contribute?
Well, I don't think it puts you in jail. Technically, the only control the feds have over the state has over the counties is the floor caps. And so if you quit putting that money in, I guess arguably they could withhold some other funds that you would give to the state and replace that money. And that's all right. That came back when I had to make that decision about cutting the reimbursement rate for everyone. First thing I said is, can you put me in jail if I do this? But the second thing was, okay, what's going to be the ramifications? And I decided the final result that I was working on was more important than what someone might criticize me. But I did get the leadership in both chambers to say, we agree with you, we'll get the legislation changed and come back to the county. And they did. But they did it after the fact, and at that point in time, I violated the law. But technically, that's what the feds will do. If the state doesn't do something it's supposed to, then what they'll do is they'll just hold other funds to fill in the gap. Do that.
Jay, on going back to the board composition, I know y'all are going to propose an interim board or a board that complies with the statute. Before the county, and I would assume, I don't know how y'all plan to do this, but I would assume you're going to submit it to all the counties and wait for them to vote one way or the other. And I think you need a quorum for the vote to actually count, which means, Ronnie, they may not put it on the Macon County, but you have to have a majority of the constituted 23 members, or however many counties it is, to vote one way or the other before you get a quorum, before you have a valid vote. So during that time, since you have Western Highlands in, and you've got Smoky in, what is the board going to look like? Because the board itself can't change until you have a vote by the counties.
I think I understand your question. First of all, there's not a real good mechanism written into this law about quorums and majorities of counties voting. I mean, I think ultimately the legislature wants the counties to buy into what's going on. But there's no good mechanism for saying this is a quorum of counties, or this is a majority, or a plurality. I mean, presumably it falls back on the secretary. When the secretary doesn't like the results, I guess the secretary just fills in those slots. So there's not a good voting mechanism. There's not a 163 statute you can go to and say this is how you vote. It's not there. It's kind of like the maintenance of efforts. I can't give you a good explanation because it's not written there in the law.
Sounds a little bit like, let's pass this so we can find out what's in it.
Yeah, kind of like.
Where have we heard that before?
The difficulty is we're already out of compliance with the law. The law says that we're supposed to have this in by October 1st, right? No?
It's 30 days.
You got 30 days. 30 days.
The clock started ticking today. Today was already the end of the clock started ticking.
Where does it say you have to be in compliance in 30 days?
Do what?
Where does it say in the statute?
House Bill 390.
You got a copy of House Bill 399, it's on page 4 at the bottom. Says the requirement for 122 118.1 not apply to both the cause country during that.
This was actually put in to call this local election merger because of the fact that it was, so we have October 1st, but finalized in, so the revision give you 30 days after the effective date of the requirement of merger.
What the counties are going to be asked to do between now and the end of the year. Sometime between now and 30 days from now, Smoky Mountain Mental Health or whatever the agency is will submit a list of interim appointees to the board, to all the county commission boards. Is that right?
That's correct.
Okay, and then it's up to all of the boards to decide, as individual boards, if they're happy with those lists or potentially add additional names to it. Is that right?
That's correct.
Okay, so we get maybe this new board, which has so many health service providers on it. At some point in the future, we reach that 1.25 million population. And how do we know that the interim board is going to reconsider who was on that board and add additional
I don't
county
think it'd be the interim board. I think each county commission would decide to have a resolution saying we want to withdraw from this provision and create our own standards for the board. So it really wouldn't be a board.
Okay.
For us, but every one of the county commissions have to do it the way our legal law. Have to be all.
And Secretary Cantor,
The board decided not to put the claims
it requires a unanimous vote of each county commission, of each county.
Not a unanimous vote of each county commission, but a unanimous vote of all the county commissions.
Okay, it does say each county unanimously adopting, each county unanimously adopting a resolution to that effect.
Well,
That's what it says.
I think the interpretation is you don't have to have a unanimous decision of the county commission. That's every county judge.
He's correct. And also, this is if you're going to ask to go to a different board after we reach that population level. We're not talking about this next action we're taking. We're talking about once you reach that population level, then changing it and waiving the requirements so you go into a new organization.
I just wanted to say, we're not going to be meeting as a commission until the 19th. That's 33 days from now. So we're not going to be able to vote on this as a commission within the 30 days already.
What type of county is it?
We ain't got time to do it.
I'm sorry.
It sounds like you need to do something about the end of the year. You have up to 8 positions because the commission suggests. How many You have 13, you have 31 that has to, but 20 of the 21, 13 selected, 8 are not selected, they could be anybody. So theoretically, 8 of these positions could be, one has to be up to 8, could be.
Well, what we were
Is that
suggesting,
correct?
what we're suggesting actually is that all 8 above 13 are county commissioners, or in the case of some of the Western Highlands group, where their county managers have been, their representatives as opposed to the commissioners. We were saying 4 and 4. In other words, 4 from the previous Smoky group, 4 from the Western Highlands group. The Smoky group chose commissioners. The Western Highlands group, if I remember right, and correct me if I'm wrong, Chuck, all years were county managers or assistant county managers.
Is that correct?
Correct.
And just clarification question, who was the nominating committee? Was it like a full board or
The
was it like?
executive committee was working to put together a plan, and I was kind of steering that effort.
So it was the executive committee of the old group, but not the authority of the county commissioners. Would it be possible that before you put your slate on those 8 seats, would they have a chance to perhaps do their own caucus in the next 33 days? To come up with 8 commissioners or 8 managers that they could agree on, which may know. I don't know, just a thought.
Well, Smoky doesn't have the authority to appoint, they don't have the authority to nominate, they just take it on themselves to nominate.
It's like nominating committee.
Yeah, but they appoint themselves to nominate, is my point. Why couldn't county commissioners be the nominating committee? I'm sure we get 8 members on there. Okay.
It depends on what the executive committee did. There wasn't a rush to judgment. We felt like there was time constraints when this process was started. And then that day, that October 1st day was changed. Am I not correct about that? So we felt like it's a necessary plan. And Michael did work, and did work very hard.
The thing that some of you may not be aware is that we also put out what was it, page and a half or 2-page advocacy plan, working to try to get changes, either changing the population threshold number or granting us a waiver, one or the other. It's a very detailed plan, and there was a resolution forthcoming, and it actually was a little more detailed and had other arguments than the one that the Western counties have already approved. That's still in the works. But as he said, we've got some timing issues, plus it's a simple logistical thing. Until this group came together, what we would have had would have been one county suggesting, another county suggesting, another county suggestion. There was no way to pull it together unless this group took a little bit of leadership and tried to suggest a slate and put it
Rules
together.
of experience also.
Well, and that was also a consideration. We didn't want to come up with a situation where all of the names were brand new names for people that had no idea what was going on in mental health, had no kind of history of all this, like Mr. Bill, for example. He's one of the names we put forward in that group. Judy Coe, folks who sat, Mr. Tarleton, who's not only been the chair of this board, but also the chair of council of community programs, and I didn't get that name right, didn't I?
Yeah.
But at any rate, that kind of continuity we were looking for in addition to representation. Some of these were hard. I'll give you an example. Some healthcare management experience with at the level of MCO. Even though there are a few people out there that can fit that bill, being at the level of an MCO is difficult. Fortunately, I believe it was Mandy Stone, if I remember correct, Buncombe County came up with Dr. Jeff Peck at Mayhead, Mountaineer Health Education, which actually is a regional, center. So it was very difficult finding an attorney. Ms. Coward, who's from Buncombe County, has previously been in Jackson, remember that right? County, has healthcare experience, because that was the criteria. It couldn't just be an attorney, it's someone with healthcare expertise. And that's her expertise in her law firm, is healthcare. So it was just a matter of timing and trying to find the right people. You know, even in 15 and then 23 counties, finding people that could meet those criteria was difficult. Now, CPAC chose their own. We didn't have anything to do with the CPAC because that's part of the statute. They chose their own.
Well, Michael, too, on that beginning, it wasn't just the old Smoky Board.
Right.
It was the Western Highlands Board and Smoky Board together.
Right. Yeah,
The two groups worked together. It wasn't just the Smoky Board dictating what was going on.
Is some of the Western Highlands, does some of you have some comments, or most of the comments might have been from the smoke?
I was on the transition team, and what Mr. Lavender did in terms of looking at what the statute said we had to do, and what he came up with as a possible slate of officers was nothing short of amazing to me. Looked for people wherever we could who didn't have a county perspective on a particular issue, but has more of a regional or cross-county perspective. And the slate as it's proposed, and I'm sure it'll probably change, but 4 of the former 8 Western Highlands counties don't have representation. The county that I live in doesn't have representation, but if the slate is adopted, I've got somebody that I can call that I know will look out for my county interest because we've done so much cross-county stuff. So, yeah, it was quite a task, and as Mr. Lavender shared with the transition committee and the executive board, kind of what he tried to cover in doing this, I mean, it was really an amazing piece of
And let me play on what Joe said. One of the experiences that I've had working with Western Highlands is, and we all came from different places, but when we got into that rooms, we weren't looking out after our own counties. We were looking out after an 8-county region. And I had absolutely no issue, this is shocking, to have Manny Stone here from Buncombe County, or Joe, or Carl, or maybe not Carl. Seriously, we had that perspective, and Chuck will tell you that, you know, you had very few issues where people would back up and say, wait a minute, but now we had control of MOE, and that's a thorn in people's side. But at those board meetings, you know, it was the whole. We looked at the whole, unlike Congress. We looked at the whole, and we tried to do what was best for the people in that region. And I'll be frank with you, if it comes down, you know, if Henderson County doesn't get a seat on the board, based on the folks that I hear and the reputations that they have and the relationships I have with them, I'm fine with that, because I think they're good people. If we start looking at this from our little political jurisdictions, y'all are going to be here a long time. We've got what we've got. And I don't think we can ask the secretary to break the law, or I think you can get I know you can get the law changed. I've already talked to the legislature. The law will be changed next session to expand the board to 36 members. And in this case, that would give each county member, each county commissioner could appoint somebody, and then you could have your 13 categories that the group itself could come up with those professional categories. So that's doable. But we got to get it from where we are now to there. And the population thing may come about, and it may be all moot point. But we got now, we know what we know now. We don't know what we don't know. Does that make sense? You went to Appalachian, didn't you? Can you figure that out? I had that class too. So, I mean, and what Joe said too is, you know, you've got this board. What if we make this board? Do we make their terms expire June the 30th of next year? If we're worried about them not, you know, appointing a new slate if there's, you know, an issue there. I mean, I think there's ways to do that, but this clock's ticking.
and the days are going to roll by, and it's going to be, before you know it. So my suggestion is we don't, nobody likes it. I can go back to a lot of more years about when the state fixed mental health. Remember that? Some of you remember that. John, were you young? But they were going to fix this as a judge when there was a rain. So this is what we've got. Let's figure out the best way to move forward. And again, I'm fine with, you got your slate. If politically that wouldn't work, the secretary will name the board. That's what's going to happen.
My opinion of how to fix it for us, for a board, is that every county appoints one person. You hold a meeting such as this, every county sends somebody, that's their voting member, and they sit down and hash it out. I appreciate what you tried to do, Michael, but having 4 people from Smoky and 4 people from Western Highlands dictating to, and I realize it's just a nomination committee, but dictating to Watauga or Wilkes or Ash or Avery or any of the other counties, I'd rather every commission, we're all throwing money in this pot, that we all get a say and sit in there and vote and talk it out and see who we can come up with. And just send one county commissioner from each county. That would be my opinion. I respect what Mr. White said, but, it's my head on the chopping block politically, just like it is every other commissioner. County managers just do the will of the commissioner. And if we're giving money to it, we should at least have a say as to who goes into that nominating.
I'm going to disagree with you. You have your opinion, we're all going to have ours, but we're salary no more than 25 members, so every one of the counties cannot name someone. 23. 21.
You better buy a house, the number's going down.
No more than 21 voting members. No fewer than 11, no more than 21. So even by that, law indicates we can only have a maximum of 21 members, 21 voting members on that board. Whether it's made up of all county commissioners or all county managers or members at large, the 13 of them are already chosen. 13 positions were chosen by the secretary and by the legislature. We're saddled with that. But we all know that we don't like what's written. We don't like how it's written because I think every county should have a say-so and should be a voting member. But we've got to move forward to get to a point where each one of the counties can come together and form the board the way we want the board to be formed. And until the legislative branch comes in session and changes this, or we reach a catchment area of 1.25 gold, then we're saddled with what we have. I don't think any of them are happy with what we have.
We talk about that, commissioners should have representation. Why were commissioners not nominated and were those people spots?
They are.
They were.
All over.
Yes.
The Central Western Highlands chose
all the county board in Western Highlands, people in Point County.
they've never had their, well, one recently had commissioners on their board has been with county managers. That's why that one wasn't that we were suggesting. That was their choice.
And it is splitting hairs, but 15 counties, Western Highlands was 8 and 4, instead of splitting that, it's almost twice as many counties in the Smoky Mountain and the Western Highlands. So,
When we talk
but
about that,
when you turn each other against each other, that's the problem with this, is it's turning counties against counties. And I agree, we need to all be in this together. I like people trusting, I like trusting these other people too, but I've got to go back and, say that I was doing the county's job.
Well, we don't need to
But those eight members is not gonna make the decision. There's still 13 other votes on that board.
That's correct.
I don't see where you feel that we're turning counties against counties.
Well, you have to decide, this board of county commissioners has to vote itself off the board. Half of it off itself off the board. So that's just by nature, half of it's being gone. I don't have any problems with the people that were chosen. I agree with that too. I've only been here a year because I was just elected in November. But, you know, I take my responsibilities here seriously. I haven't missed a meeting yet, and I've been going to finance meetings and stuff, so, it's not personal, but it's frustrating. And I'm just wondering how, I understand we're at the discretion of the secretary, and I'm just wondering if we can send her a more powerful message as a unified group to get it, because we are it's 1 million people in North Carolina that are their representation is being changed.
One thing I'd point out there in terms of your comment about the 15 and the 8, ironically, however, when you look at the population,
They're more.
that they, and I didn't bring the figures with me, I wish I had, I don't know that you brought that up, but they're roughly, gosh, I'm gonna take off my glasses to see, that's pretty bad. The percentage breakdown here, I had made the percentage breakdown on the list that I had, but it's closer to half. I don't remember if it's 49, 51, or 59, I mean, vice versa, but population-wise, they're roughly half.
Okay.
County-wise, they're roughly.
But that's still splitting hairs, right?
Yeah. So, I mean, we have to look at it both ways.
Well, and one of the things, I started working 35 years ago in Madison County in mental health, and for the past 35 years I've been involved. And one of the things I strived my entire mental health career to do was to not be put in a position of responsibility without authority. And that's exactly what y'all are up against. And we talked about that at the executive meeting, and so what we tried to do was to maintain some history on the board by keeping the commissioner members. And in the case of Western Highlands, let's keep the county manager members, because all of the folks on the slate from our side have been at the table and working on this a long time. But if it were a job and somebody was putting it out to me this way, I'd have walked away. It is the least tenable position ever to be in, and y'all are in it. To be charged with the responsibility, and somebody's pulling the plug on your authority.
Well, the reason for that is when it goes awry, when things blow up, when your ER is sitting full, when the sheriff's department says, I don't have nobody to send, who does it come back to? It comes back to your county board.
Yeah.
Every time, not to Smoky Mountain, not to nobody else, it comes back to your local elected board to deal with. And so that's the reason that, we've tried, conversations today, every day, with these folks. We think we had good cases about our population. I think it's a strong case. And it's already been done. Why it was not given to us, they said their attorney, they would not give it to me in writing, we asked. Didn't have to. But former Secretary of Counsel has a really good point. This, with what I can see, and of course somebody I don't know that really experienced can tell, they won't do, they're afraid, I don't know if afraid is the right word or not, but they're very careful not to push up against what the law reads, as it reads verbatim, word for word. And we saw that. What I was told today, the only way we could do that is to pursue through the governor's office. Well, I think they're in the same position. But we're willing to do that. I mean, we're going to try that next. We were hoping, and they're meeting tonight, by the way, about this, about our meeting. We're to give a report back on our meeting. So then there's a good point from Henderson County. Do we go ahead and do this? What I worry about, there's nothing that says that the threshold of population can't change. They've got us all a little bit paranoid. I'll just be honest. Anything on here they can change. And, and as county commissioners, that's what we worry about.
So what's going to happen in the next week? This isn't a voting body here.
No.
So we took the discussion of the slate off the agenda at the last Smoky meeting. I assume it'll be back on in our next Smoky meeting, and we'll have to vote on it as a board, and that's in a week or two.
But that doesn't that's just to send it to the counties. That doesn't establish the board, that's just to send it out as a nomination essentially to the
So
counties.
we're going to be out of compliance because we're not going to have a meeting within 30 days to approve it.
Well, the 30 days is actually.
We're not out of
Secretary
compliance.
She signed it today, Mr.
Did
Gill
he
said.
sign it today?
Didn't the 30 days
Well,
start
I
today?
thought the clock started when we approved it.
That's what.
No, it's when 30 days from when she signed it.
I think it started with the secretary sign.
She has the clock start ticking when she puts her name on the
She
document.
signed it.
No.
That could be next month, the month after.
We could go right at these, yes, it has, but I don't know that.
It's not.
Oh, good. Well, as long as it's not been signed, maybe she's thought for me for a long time.
So we are, that 30 days hasn't started yet. We will be under that time constraint as soon as, so we do need someone needs to let us commissioners know as soon as she does sign it, so that we can make sure it gets on our next meetings too.
But who governs in the interim?
It's the existing board.
Okay.
Difficulty, two things that are difficult in my mind, is these don't move forward in compliance with the law. One is that, of course, the idea that she would appoint somebody. If anybody's read any of the articles of use and observe her as a parliament, you know that her choices are not necessarily the kind that we mount folks like, but that's beside the point. If we're trying to curry favor, for example, to pick up an extra couple of counties where we're in the driver's seat, the likelihood of the secretary being very amenable to that, if we can't even agree to comply with the legislative mandate, is probably small. And there are other things that we're trying to, I hate to ask Brian Ingram to step in on this because he's trying to stay to the side. But I'm sure that there are things that you're asking the secretary for every day on behalf of smoking. If we thumb our nose at them, what's the likelihood that we're going to get any of those things that we've been getting up to now? And think of it this way, and as much as I like my friend Ronnie here, if Macon County passed an ordinance in their county, and some of the people that were affected by it just said, I don't like your ordinance, I'm not going to comply with it. We'll wait till the next set of commissioners come in and we'll get it changed.
Well, they've done it pretty regular, huh?
But at the same time, that wouldn't sit with me, I'm sure if
We'll write it out wrong, that's what it is.
And I understand that, and none of us disagree with that. But what we're saying is, in respect of the office that those legislators hold, let's comply with it now and work to change it. None of us are saying, live with it forever today, we're saying work to change it, but in the interim, let's comply and move on so that we can get what we need. We can spend all of our energies working on this for 6, 8 months or longer, but we're missing the point of why we're here. We're here to serve the constituents who have mental health needs. And if we're spending all our energy working on a board governance issue that's a law, instead of working to spend our time trying to make mental health services better for our consumers, or making it more efficient in terms of the dollars that we're talking about, then it seems to me we're missing a boat. That's just my opinion.
I would be fine keeping the smoky board as it is, let them govern the thing until it gets law changed.
I'll second that. I mean, I feel comfortable, what Steve said earlier, I feel comfortable with the people around this table. I know Ron Beal. I know Rick French. I know John. I know people who are in those counties who will not just look at their county only. They will look at the whole system. And I feel comfortable that if that is the solution, the best way forward, I would go the same way.
Does that help you guys? I'm trying, we didn't get a chance to talk about this ahead of time, and I'm sorry, but this is going nowhere. Okay? You're right. This is kind of a bitch and session, excuse me, lady, and it is every minute.
The real reason we're here is for people, it's not for us, or figure the government type, we're directed by the state legislators, is what we're going to do.
that's what we need to do to go forward. We'll do that. However, with modern GPS technology, I can't find you people.
All you need, when there's a problem, we'll send them.
Is that correct? Now, I'm throwing that. Okay, what do you think?
Problem is, it still doesn't apply.
Still doesn't apply.
Law says we've got to have those 13 positions.
Well, but that's not my problem now. It's your problem now.
Seriously. No, y'all got to figure that out, because you're the board.
That's right. That's true.
So y'all have to figure that out. And you'll do a good job. Because you done a good job tonight.
Now, Michael, I do know that we're here for the good of all those mental health patients. That's why board governance is critical to me. That's a part of taking care of those patients, and it has to be discussed, and the board has to do it. So that, to me, is important as much as the day-to-day operations, which Smokey does a good job of. So it's a two-part. It's not just, and I know I'm just going on and on, but it's not just taking care. It's making sure that those people are represented all across the area, catchment area. So other than that, I agree you worked hard on this, but board governance is an important issue for the board to discuss, and it's not wasted time.
Let me just ask this, because one of the things we talked about is the county commissioners get together and developing who they think ought to be on the slate. 13 positions, I have to say it's a difficult deal. I'm not sure how you feel there's just know somebody. You really got 9 positions. The Smoky Board has not yet adopted the slate to recommend to counties. So why don't some of the county commissioners that are concerned about this, or although you're having one that get together and create the nomination for those 9 slots, so that when the Smoky Board does it, you can put that nomination forward and we can change the slate.
And still keep trying on our efforts to
And
get
still
the
be
law changed, and I understand we have
If
to
you want to realign the slate, that's a decision the majority is going to control. But if you want to realign the slate, then come up with a different slate and offer it to the board and see, and you got all the members to decide what the slate's going to be, and to sit out.
And that's not really my problem. I don't have a problem with the individuals. I have a problem with the law.
I understand.
So
But
I'm
in the
trying to-
meantime, that way you can comply with the law, have the board that's going to do in the interim. In the meantime, work with the legislature. You said you've already talked to some of the legislators who said they'll change the law.
But they said they changed it before and didn't get
Well, they did,
changed.
they changed it to this, and then they changed that little provision and gave you more time. And I can't predict exactly what they would do, but I think that the county commission association, whatever it's likely to happen, I truly believe that within a year, you're going to be able to get 1.25 million anyway, and you're not going to have a problem. But you're just having to do a transitional move here until one or the other happens. But if you don't like the slate of the 9 that's on there, then I would suggest you offer a separate slate for the board to consider. Then the board can recommend to the county, and the county can decide what to go with.
Greg, just a suggestion to follow up on what we've already talked about. Maybe the secretary could be asked to drop a pen for an additional 30 days. Because until she signs it, that 30-day thing doesn't start. That 30-day deadline doesn't begin, correct? That's correct. So if you would, Chuck, ask her basically to say, we'd like you to hold off signing this while we work, because 30 days is a quick time to turn it together, a board of 23 counties and 21 people. We'd like one more time, Smoky Board can then get together, work over the nominations that, Mr. Ladder's come up with. If y'all come up with something, a different program, send it on out. So, I'm serious with Steve, and y'all are doing, I mean, we do trust you. And we think you'll represent the whole area during this transition, because it's an interim, we truly believe it's an interim step.
All the providers are pretty much the same, a few differences,
And with you, we've seen the quality of the staff work. I mean, in a real short period of time, we have seen the quality, we appreciate it.
Yeah, believe me, it's a step up when we started working with, Christine.
Yeah, Brian, question. But it is, it really is. It is, we want you to, from Rutherford, and I think from all of Wisconsin, we feel comfortable, we're happy with the merger, with the good partnership with Western North Carolina. And we don't think you're going to, it's only in our board. So.
I'd like to jump in just real quick before this. We
we literally just started over from, I'm sorry, I just got me nervous because it sounds like we're getting kind of close. Let me ask you, Steve, are you part of who are the 4 managers that we're talking about?
I know that I'm not one.
Yeah.
I'm sorry, class, and
I am
Mandy Stone is one.
Andy, she's head lead,
Uh,
Marsh Pittman.
Mandy, Marsh Pittman out of Polk, and myself, Pinchot.
Okay, I was just trying to figure out, because I heard the managers talking, I was trying to figure out who was actually stepping up saying, well, I'll just give it back to Smokey. I was trying to figure out how.
Well, Smokey, I'm just saying,
I
y'all are
understand
doing
not
a good
getting
job.
back.
Yeah.
And it's an different thing, let me tell you, I mean, they let Buncombe County, they're let. But we talk all the time about all kinds of things, and we're interim, you get Smoky board, and to be honest with you, did anybody really volunteer? Did you volunteer?
I got volunteer by board by board.
You don't have to walk up to meet the 13 members, the slate that you put together to meet all of them. If I'm gonna cut to the chase, what we're talking about is 3 people, right, or 3 representatives, right? We're talking about representative from Wilkes County, representative from Talbot County, representative from Mayberry County. Is that correct?
No.
There are only 9 of the 23, so there are 14 not represented, unless they fit into those categories. I don't know how many he was
Okay,
able.
I'm sorry, I'm only hearing from 3 counties right now. So I was just trying to see if the numbers were.
They were doing such a good job, we just kept our mouths shut.
They're from up north, they talk about.
Whoa.
Can I like make a point of order, so that we can, get organized with this idea? First of all, I don't think this body has anything other than an advisory capacity that we can't really combine together and vote and make anything really happen. Our boards will have to make stuff happen. So if we do have a consensus of what we take back to our counties, we could vote on that. We could say, here's what we think we ought to take back to our counties for the counties to act on. Right? Does everybody agree with that?
You're right.
We have no authority right here to do anything.
You're right. The problem I have with the selection that y'all made is Watauga County had no input, so Watauga County's probably not gonna go forward with it. If Watauga County had a voice in the input, even if no Watauga County people were on it, if we had a voice, maybe we would, we're not on the executive.
What I'm hearing is a point of order, again, just so we can follow up on your original, what sounded like a motion.
It was, that's because it was a motion.
It's inappropriate as it was.
That what we would do is send to the counties the 13 nominations that we've made for the 13 positions, and then ask the county commissioners to get together on the remaining 9 and make suggestions about who they, or make nominations. about who.
Well, it's not just one of those 13 that's going to.
Yeah, that's right. Yeah.
Well, and with all due respect, by the way, Mr. Miller, Watauga County does have a voice, because even though the executive committee put together a recommendation, it came to the board, it will come back to the board, and your representative, Mr. Kennedy, will have a chance to vote on that. So you do have a seat at the table. It's kind of, well, you know, I
He can vote on
understand
the
what you're
slate or
saying.
not.
Do what?
He can vote on the slate or not.
Or suggest the.
All right, one more point is that you would make a request to the secretary to hold off until the county commissioners came back with recommendations for the other 9, correct?
Well, yeah, 8 or 9.
And this is what, hopefully tonight at their meeting, this is what we asked at 4 o'clock today, is that they would take into consideration the things that we've asked since last May, because it was going to come to this. And it's not who's the 13 members. I mean, Michael and the transition team, which I've been a part of, have done a great job. We're going to try to represent Watauga, we're going to try to represent Henderson, and all these other counties. But at the end of the day, I'm elected so people make counties. But you got to look out for all, especially in the association, trying to represent all the county commissioners and trying to do what's right. And I don't think there was no ill feelings about relieving nobody. But the fact is, we're all going to be left after county commissioner. That's where we're at. So I think the key is to try to get it, kick the can down the road. And I even made it, to let the four managers from Western Highlands come on our board. Now. Let them come be a part of the board now.
No, we don't do that.
Well, I'll ask the secretary to do that.
Okay.
Yeah. But I mean, whatever it takes to put it down, we can get this thing changed and make it where it's palatable for all the people around this table, especially the elected officials. And so if you got any suggestions, I mean, we have the resolutions that we have sent forward. We're going to be, and I'm going to be hand delivering them to Robin. And we've talked to our representations, and we've done this before too. I mean, just without the law change, I think the only thing, what we're asking for the resolution is real simple. It's just an extension of time. That's all we're asking for. And because I think that's all they can do. They turned down the waiver on the population, just gave them something to hang their hat on. They could have done that, because the precedent said. But until then, I think if there's anything that we can do is just ask for an extension of time.
Well, I assume we had consensus on that here, for sure.
And hopefully, I don't know, we'll try to get you to find out what went on tonight. If we talk to him, I'll talk to Mr. Richard. He gets up pretty early because he's learning I call early. So, we'll just see what went on and we'll tell him, I just need to know how you all want me to represent this body in relation to the secretary and to Mr. Richard. Dave Richard he's over the division of mental health. He's a good fellow, I think. I think his heart's right. I think he tries to be the best. They didn't have no voice in this legislature. None.
Yeah.
So, I mean, I'd like to have a little direction too. Not that I'm on board, but I will talk to them. I'm a little shy, but I will talk to them.
Notice that. Just a question. If the secretary, each Western Highlands and Smoky passed the consolidation agreements and all the consolidation documents, none of that goes into effect, as I understand, until the secretary next signs them and says, these are okay. That triggers that 30-day issue. Absent her acting on that, right now, Smoky consists of 23 counties, correct? Okay, absent her doing anything. So in fact, what can happen is if she doesn't act to sign the documents, we still provide, through Smoky, services to 23 counties. And we can just let that hold until the legislature meets next year. What it would mean is that Western Highlands...
The law says that it's the later of 30 days or April 1. The longest it can go under the law of April 1.
Gotcha. Next year's the short session, which doesn't take
And
that.
they don't come in session until third week of May, our second week of May.
So you're saying the secretary is that proactive and really wanting to jump into this and start appointing members to this board?
No, I'm just saying that under the statute.
I understand that what he's saying is continue as is without her signing it. And so again, that 30 days.
You're trying to create that interim situation. It sounds like the problem is an April 1 date right now, is what we're going to trip up against. But otherwise, on an interim basis, the Smoky can act as the interim board, if you will, and rally, they're the board. And, what will happen is we'll have to do something by April 1, get a waiver, ask the governor, ignore it, whatever, the secretary does to get us through till June 3rd.
There has been a consolidation agreement for those who might not have followed this. There's a consolidation agreement between the two boards. It's been signed by the chairs of both boards. So it's a working entity. It will work.
But it's not in effect until the secretary approves it.
But it's still practically.
The merger's not the secretary's time.
Practically speaking, though, it's going to be working as if it were.
It's working now.
It better be.
It better be. So, at least it gets us till April 1.
Yeah, it gets us to April 1, and then it would be up to the secretary to appoint. But if she decided through Ronnie's lobbying efforts to just hold off until the short session was over, because, it took a year to get somebody on the community college board, and our local community college board. So by the governor's appointment, I don't know if she's any quicker than Pat is, but if she can hold off 2 or 3 months while she shorts that up, I think we'll get a change.
Let me just say this, the contracting process where they contract or they give the MCO the contract to provide the service, I think has to be finalized before or by the end of the year or something. The problem is if she has an approved merger, then she has an issue with who she's awarding the contract to perhaps. I'm not a lawyer, I'm a CPA, and, you know, what's 1 and 1, it's kind of but the thing is there's other issues here that she's gonna have to deal with just besides what we want on government. And I don't know how that'll play out, well, I can find out, but I don't know that. But there's a big process going on right now, all about trying to answer final questions so they can get a contract ready to send to us. And I don't know how, if we're not signing that, in any way impacts that process. So I don't know. It does.
And we don't really know what the repercussions are. That's what we've been trying to find out all along. If we stick with our board, and you know, the biggest risk is that she'll replace the whole board on her own. That's a possibility.
And I will tell you, the other thing that you have to worry about when you're setting her shoes is creating a precedent. And I realize there may be a way with the Wake County, but now Wake's part of the alliance, so whatever happened there is kind of changed. But there's other mergers in the works right now. And once she creates a precedent for a process of doing something, she's screwed. So she's got to be really careful about creating the precedents in the way that she does things. Otherwise, she's going to have to deal with the same issue over and over and over.
One last comment. Is a way to kind of conclude someone that gives the folks who work so hard putting together this transition is if it would make it more comfortable for the Smoky Board to spend a little time talking about this and put out the slate after the Smoky Board meetings. Maybe Chuck can be invited, don't that know Chuck. Maybe Joe or the other members of the Western Highlands transition team can be invited to that Smoky Board. Y'all put out a slate that you vote on if you feel comfortable as a Smoky Board. You may not all agree, and you know the limitations. There's 21 seats, there's 23 counties. You know, we see this, like I say, as an interim step. But if it works, because we've got, because the mayor's right, Ryan's right, they've got headaches up and down the chain of command on us that are going to be contracts with the federal government that we've got to fit in their slots still. And we can't resolve that here, but give it an extra 30 days, the Smoky Board can meet, thrash it out, send out the nomination list. Just include maybe the transition team from Western, so you've got some input from Western, if that works. Maybe that's the way to resolve this, not trying to resolve it today.
Can we just ask this? In conversations tomorrow, to give a report on this meeting tonight, would it be fair to say that after much discussion with the 23 counties that are involved, Western Highlands and the merger with Smoky, it's a consensus of the 23 counties, managers and commissioners, with blessed assurance from their attorney, that we ask the secretary to please, how do you want to word that? What do you want to say? How do you want to talk? You want to say, well,
language, I can't use that language here.
I mean, there's a lot of good, you're a county manager, you're pretty good wordsmith if you're around this table, so how do we want to report tonight's meeting?
Hold off signing the merger document as close to April 1st, 2014 as you can.
Well, I would say just hold on tentatively while the Smoky Board meets and reviews the slate to be submitted to the counties.
Yeah,
Give us a little more time. It may only take, I'm not sure what the Smoky Board is next scheduled meeting, they have a special meeting.
We're saying we're good with y'all doing.
Yeah.
But Brian's got to have a little bit more certainty than I think we're talking about.
Well, let me just talk about one thing. The secretary needs to finalize the merger consolidation agreement. They're going to have to change a contract so that they've already, I mean, the day we sent it, they started asking us questions. So she can't not do that.
Yeah.
It's gonna have to get executed, very quickly.
It is.
Because of the need for contracts to work and all that, so it's just, I don't see that working.
So y'all will.
Okay.
And we have to take legislation.
I'm fine with y'all just being the board, because it's a short period of time.
One of the things we could do, Mr. Chairman, one of the things we could do would be to revisit the board. One of the things we could do is to let folks go back to their counties and talk amongst themselves. This will be on our agenda next week as a smoke board. But then, I don't know how many of your counties do this, but we sometimes have first reading and then second reading. We could treat it almost as if this were first reading, and then come back with, in the meantime, folks can send suggestions if they have different suggestions. And visit the November meeting, come back up as kind of a second reading before it even went to the county. And I think we'd still be in compliance with the time frame to do it that way. That would give folks plenty of time to send in other suggestions. For example, if Watauga County wanted to send in a suggestion to put its name there instead of my name, for example, which is fine. Try to think, Haywood County wanted to submit their name in place of somebody else, that's fine. But then at that November meeting, we considered, before it went out to the boards for vote, that would at least give us another 30 days to look at it.
And also give long time to talk to them.
Right.
And then it's still got to go to the Board of Commission, and after it gets it,
That's
the
what I'm
board
saying.
have to vote on it. So there's a delay at
December.
best.
We're just trying to sort of get our.
I know we need to wrap this up, and we're just talking about the resolution that's been passed by 6 of the 7 Carlisle counties.
We passed it too.
I'll read it real quickly. If you want a copy, it will take me just 2 minutes to read it. The resolution urging the Monroe County Department of Health and Human Services, the Monroe County General Assembly, and the governor delay, revisit, and revise requirements concerning the governance and appointment of elected county officials as board members to the Smoky Mountain LME MCO Board of Directors. Whereas Senate Bill 191 has been approved and passed into law in the waning hours of the 2011-2012 session of the General Assembly of North Carolina, whereas the bill/law does not provide counties the flexibility and oversight for physical control of the regional LME, even though counties are still required to fund a portion of the cost of the system, and further hinders our counties from providing needed communication and oversight in terms of services and special needs in their respective jurisdictions. And whereas counties of the Smoky Mountain LME MCO provide over $2 million each year from local resources to help pay for the operations services rendered to this organization, plus countless resources to provide support to deal with mental health issues in our own jurisdictions. And whereas our elected county commissioners, stewards of the public trust, and providers of a vast number of human services programs have all been but excluded in the revised makeup of the new governance requirements as set forth for the state. Whereas the new membership of the rules of LME limit the required designation of only one voting county commissioner from 23 participating counties and limits the total membership to 21 members, with most of these members having to be representatives of specific occupations and groups. And whereas the current proposal to form an advisory board of county commissioners with no voting power oversight whatsoever, no authority concerning financial affairs and programs covered by the LME. And whereas these new rules are to be complied with and members appointed to the LME by the board by October of 2013, and its member counties face penalties from the state, and whereas the General Assembly has the authority to review and modify these requirements, legislative understanding that counties and the state have a vested interest and obligation to provide adequate mental health services and oversight for our citizens in a responsible and realistic way. And whereas in a recent meeting involving all 7 counties, this is when we got together, the reason that the consensus was to formally approve a request to delay the implementation of these new governance rules until more study consideration was given to improve the structure to allow more direct input and financial control by local elected officials. Now therefore be resolved that every county Smoky Mountain LME adopt a resolution in support of the governor, that the governor, the Department of Health and Human Services, and the North Carolina General Assembly seek input and membership about the direction themselves. So this is basically the resolution that we're going to send forth, and they have a copy of it. And in our discussions this afternoon, the question was asked of me, how much time? And I said, as long as we can. I think the key, I don't know how y'all feel, but the key for us really getting this fixed is the population threshold. That's the real key. And I think to really change the board, I think that's the only thing without changing the legislature, or without going through the legislation is the population threshold. So I just need a little direction. I'd be glad to carry whatever report from this meeting as you all see fit as county commissioners and county managers, because you represent the counties. And I'll do my best to convey, or y'all can convey to them. I have, I've got their cell phone numbers. We call them now.
Roger, first, can you send that to the Western Highlands counties?
Sure. We'd be glad to. I think Chuck sent me all of it.
Carl, I forwarded a copy of that to all of you.
Also, for the reader email too?
Of this resolution you did?
Sorry for that.
So,
Probably back you up yet, did you?
I
Probably back you up yet.
didn't read it, but so on tonight's meeting, I just need to know a consensus of how, we're in agreement that it's not about the merger. I don't think it's nothing about the merger here. I think the merger can be good for all of our counties. I really think that. But in the meantime, it's about governance, and the governance does play a part in the deliverance of services. I believe that too. So, whoever wants to, I just need a little direction with the chairman on how we want to give a report, or if you want to write one up and send it to me, I'll be glad to. Thank you. Yes.
Can I ask a question? Now that you've heard that resolution from the southern counties, of course, I know you can't speak for your full boards, but do you think that who's represented here, the 23 counties, do you think all 23 counties could support that resolution as read today?
We've already passed it.
I know there's 7, there'll actually be 8, I think, is committed. It'd be neat if we could get 23 counties signed on to that resolution. I mean, it's all about the oversight. It's, I've heard a number of times, and it is about the people we're serving, which the folks that need the service. But there's another group that we forget about. It's the taxpayers on the other end that we're elected to protect, as well as those folks that need their service. So that's what this is about. I think it's what most everybody can agree, that when you lose your representation and you're forced to fund, nobody likes that. It's from a farmer to a brain surgeon. Nobody likes that. So I just wondered if we could get 23 counties to sign on to this resolution.
Well, if you can't answer the question, Chuck has sent it to all of y'all, and whatever y'all decide, we would like to see that happen. We think that would, I was told from that office that they're looking for something they could, without breaking the law. That's a real concern. The secretary is exactly right. The real concern of that office is about breaking the law.
And I just want to add that it's not the selection, it's how to get them to change what's wrong.
And we're just asking to give a little time maybe for the legislature, I think even the governor's office. We're just trying to buy time, we're trying to kick the can down the road.
We've been here 2 hours. Are we ready to wrap this up? I think.
It'd be neat to get what the consensus in the room was on that, just by a show of hands.
Okay.
They just support that just by those
What he's
individuals.
asking for is most of the counties.
Not a vote.
Not a vote. You think this resolution, the way it's worded, and you can read what Chuck has sent you a copy of and change the wording as to suit your county? Do you think most counties can support a resolution to that effect?
If we can change the words, yeah, we can support it.
Okay. Have Charlie Messer
We'll work on it.
So I can report back.
So it looks like we got that. So-
Yeah, I think we got that.
Oh, listen, thank you, everybody, for coming tonight. We had a great discussion. I know we're not all going to agree on everything, but I appreciate everybody being here tonight, sharing your thoughts. So, if we're adjourned, the smoking outdoor next Thursday,